Very good. Well, since you're here, do you want to just jump right into
Yep.
COVID? The work never stops.
No.
I'm
That's
only
okay.
looking for good news, and I see hospitalizations seem to be going down, so I hope you'll comment on that, or is that just what I think? I didn't mean the positive test, excuse me. Hospitalization has been pretty flat.
Yes. Correct. So moving into the COVID update, we have crossed the 3,000 threshold for new cases as of this morning. That includes positive tests and presumptive cases. We're at 2,885 positive tests, 33,297 negative tests. Our weekly percent positivity rate for last week was 8.6%. And we saw 240 cases, and that is the third consecutive week where we've seen a decline in cases. So that is encouraging. What we are currently doing to prepare for the fall and winter is to order flu vaccine and get contracts set up with our first responders and EMS agencies who we already have contracts with for specimen collection and testing. We're issuing contract amendments that are pretty broad that will say that they will agree to administer vaccine. We're leaving the vaccine pretty broad, so it can be a flu or potential COVID vaccine in the future. So we've already placed an order for vaccine and working with at least 3 partners who have expressed interest in administering flu out in the community. So we have
Administering flu vaccines.
administering flu vaccine.
Not administering
Thank
flu.
you.
I've got to interrupt you. And what do we normally do? Is that normal? Is that a stepped up effort?
This year we're going to pay for it. Last year we did a kind of like a pilot project with 2 agencies, and we just had an MOU to work through how this would go. And my understanding was prior to that, I think H1N1 in 2009 was the last time that we utilized this model for administering flu in our community.
I'm going to interrupt you like I like to do. I'm sorry.
It's
But
okay.
Jen and I were talking about and we haven't really talked to you, and you're the expert on this, but it seems like you'd like an enhanced normal flu vaccination program and early to kind of get those questions out and get that out of the way, because we've been concerned and we have talked about the confusion. Is this the flu or is this the flu? And so we'll have to be talking about that in the near future, if there's something we can do or if it's that important to do, but it seems like it would be.
Absolutely. We received Region 2 counties, so Marion, Polk, Yamhill, and Benton and Lincoln received a pot of money from the state related to do some regional COVID work, and we're actually choosing to use those funds for some messaging around flu vaccine, because we know that if you're protected against the flu, that could ultimately help your COVID outcomes if you get it. We don't want people to be in a situation where they have COVID and the flu. That could
Is
be
that
pretty
possible?
bad.
You could have them both?
Yes.
Oh, my.
Yes.
Oh, thank you.
So as we move into the fall and winter, when the weather forces us indoors, we want to make sure that folks have the most protection possible, and especially our vulnerable communities who are more susceptible to flu and more susceptible to COVID as well.
We've had some success with the mobile COVID test as well, right?
Absolutely. Yeah, our partners are awesome. Woodburn Ambulance, Illuvium. We just started a partnership with Falck, and we have some other great testing partners in our community as well who are volunteering with those agencies out in the community. So I think it was last week I said, we're underneath the Oregon's average for testing. If you look back about a month, we were a little bit under that state average for testing levels. And so I said, hey, do you think we can get 100 more tests per week so we can get a better picture of what this pandemic looks like in Marion County? And we had a couple partners just step up and say, yeah, we're going to start testing weekly. Woodburn Ambulance, Illuvium, and some other community-based organizations just got it organized within a matter of days. So we have a really great network of community partners that are stepping up and doing so much for the health and safety of Marion County residents. So really encouraging.
Wonderful. Okay. Anything else?
I do, yes, as usual.
Please, yeah.
No. Let's see, we did the saliva test a few weeks ago. In one of our meetings, you said they didn't get all the positives they wanted. Has there been any more? I was pretty hopeful that that'd be a valid test.
Yeah, I'm not sure what the next steps are with that. If we're going to do another one with the University of Oregon, I haven't heard. I would need to check in. I had some other folks helping out with that event, so I'll need to check back in with them.
Okay. You.
Thank you, Katrina.
Thank you.